My name is George du Toit. I'm one of the pediatric allergy team at Guy's and St Thomas's Hospital and at the Evelina Children's Hospital. I've been asked to speak to you to the question of whether my baby should avoid nuts. So there are two scenarios that commonly arise. The one is a no or low risk scenario, and often we don't see these patients in clinic, and you probably wouldn't be watching this video if you were in a no or very low risk scenario. What is more common is people worry about this question where there is some risk in the family. So this risk may come about due to a positive family history, a cousin who's allergic, or the parents have eczema, and they're worried that their young child may develop peanut allergy or one of the other nut allergies. And this is a very common scenario in that 3% of children in the UK now have a nut allergy. In children with eczema, particularly if the eczema develops early and is severe, that risk goes right up to 20 to 30%. So it's right that we are concerned. There are only two options with regards to nut allergy prevention. The one is to try and avoid this, and we've now seen over the last 2 decades where countries who have applied avoidance strategies, such as Australasia, the UK, North America, now sadly have the highest rates of nut allergy. What about early consumption, introducing nuts to your child's diet? Well, we recently published the LEAP study and the EAT study, both studies performed at King's College London in this hospital itself. And these showed a dramatic reduction if you were able to introduce early peanut to an infant's diet. And in the LEAP study, they were high-risk infants with eczema or egg allergy. And in the EAT study, they were drawn from a general population, so a regular risk scenario. So the LEAP study only investigated the question of peanut introduction, and this unequivocally showed that the introduction of peanut into high-risk children, so children with severe eczema and or egg allergy, was a better approach for them than avoidance. There was an 81% relative reduction in the rate of peanut allergy. Now, just a word of caution, in the LEAP study, children were screened before peanut was introduced, so they had a skin prick test. If the skin prick test was 0, 1, 2, 3, or 4 millimeters, they were then enrolled onto the study and fed peanut under supervision. That group of children, and there were some 76 children, with a larger skin prick test, they excluded from the study and were not fed peanut at the word go. So this is not an intervention for all at-risk children and only an intervention after screening. What about children in the general population? Well, the EAT study enrolled a larger population of young children and fed them 6 common food allergens very early on, from 4 to 6 months of age. And these were breastfed babies, so breastfeeding was ongoing in the study. And for egg and peanut, they found a reduction in the rate of allergy, much like was found for peanut on the LEAP study. Again, this was shown to be safe. So what I would encourage you to do is, if your child is at risk, either because there's a family history or that your young baby has been born and now has developed eczema or another food allergy such as egg allergy, I'd strongly encourage that you ask your GP to refer you through to an allergist or allergy center where skin prick testing can be performed. If that test is negative or extremely low, then under supervision, I strongly encourage parents to undertake this intervention of eating peanut. Peanut's exceptionally healthy. There are many health benefits, so if you're not allergic to it, it's a good foodstuff to have into your diet. It is extremely satiating, stops children snacking on certain other snack foods. So overall, it's a healthy benefit, and it can help reduce the rates of peanut allergy. If your child has a peanut allergy, what about the introduction of tree nuts? So that question has not adequately yet been answered in the scientific literature, but we know that 60% of peanut allergic children will become allergic to tree nuts. So this is a valid concern. What I do is undertake skin prick testing and IgE testing in some patients. And again, if this value is negative or very low, I encourage the introduction of the nuts. If it is low, I do this under supervision. If it is negative and families are willing to do so, it is safe to do at home in the presence of a negative test. If these tests are moderate to high, then avoidance is the best scenario, as established allergy is already then likely. So it takes some finesse and allergy testing in high-risk scenarios. In low-risk scenarios, as happens in everyday life, young children are eating nuts. Not whole nuts, because you can obviously choke on this, but nut flours, butters, or pastes. And certainly this is what I encourage. There will be guidelines that are imminent. The NIAID American guidelines are looking into this question in a very scientific and detailed way, and other guidelines are likely to follow. Some allergy societies have already changed their guidelines to be in line with the LEAP findings. So this is all very new, very novel, and it's an exciting time for you and your young child to be introducing nuts to the diet. 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 Introducing nuts